Now, back to Coastal Living on KZTV.
Welcome back, everyone. Thanks for watching Coastal Living. Please welcome Carla Hoffman. She is the owner of Hoffman Hearing Solutions. Thank you for joining us today.
Thank you for having me, my dear.
Well, we're really excited to have you back because we're covering something a little offbeat from what we normally talk about when you visit us. There is a link between cancer patients and hearing loss. Is this correct?
Yes. So what happens is when a patient undergoes cancer treatments or when a patient undergoes chemotherapy, your hearing system can definitely be affected. So what we recommend is that if a patient knows this, they're going to be going into this, to get a baseline hearing test. That way, after treatment, you can have another test and see if there's been any changes to the hearing.
Okay.
And if so, what would that mean? But not only that, we actually recommend that everyone look at having a hearing test starting around the ages of 40 to 50.
Okay.
Just baselines, especially if you have hearing loss in your family or especially if you're a musician.
Yes, and we've talked about that before. Being a musician or being in construction or just a loud environment, people in the oil field that are around these big loud machines, you don't even think about it. I don't think twice about it. And to me, it's almost like, I've got a live drum set right behind me. I've got these huge speakers right in front of me. Don't even think twice about it. Probably losing a significant amount of hearing at this point. But, whether it be a cancer patient or somebody who is not going through any sort of cancer treatment, I agree with the fact that it's something that you want to get tested for a baseline. So even myself, because of my profession, would you recommend coming in sooner?
Yes, I would. And then you can keep an eye on it. But what I tell patients all the time is anytime you have a major health issue in your life, anytime you undergo something that puts you in the hospital, cancer, diabetes, heart attack, stroke, get those treatments. But before you go through them, go ahead and get that baseline. And then afterwards, you want to go ahead and have another baseline ran.
Okay.
Because we do know that these major health events do affect the hearing.
And it's not anything I don't think you would think about. You're so concerned with dealing with the struggle that you have in front of you that your hearing is the last thing that's on your mind.
Right.
So why do you think it's so important? How is having that tested and maintaining our hearing going to affect our results after?
So you may not see a big change right in the beginning after undergoing some treatments, but we know that there are residual effects that happen afterwards. And so while you, as a young, beautiful musician, may not have any hearing loss today, it could come about when you turn 60 or 70, because it takes that long for the loss to develop.
Okay.
That's why you want to have get those baselines and then monitor. If you have really good hearing, maybe a test every 2 years. If you're on the verge of your encroaching hearing loss, maybe every year just to watch it.
Okay.
The other thing we watch for is how well the brain understands speech in quiet and in noise.
Yes.
And that's one of the things we're really focusing on, is making sure that that patient has the best hearing in every environment they're in their lifestyle.
Absolutely, and that leads me to my next question. You're talking about people going through cancer treatment. Well, there's children who have perfectly fine hearing, but unfortunately, it's tragic, but there are children that suffer with cancer. There are children that have to go through these radiation and chemotherapy treatments. How does that affect their ability to learn if they're losing their hearing?
If you can't hear, you can't learn.
Exactly.
And it's really important for their speech development and their learning that they do get treated if they do have hearing loss. It's critical in those young years.
Okay, so something to consider if you're a parent out there and you have a child going through any health issue, period. Although they're super young, we recommend having them tested just for a baseline to have something to go off of.
And they're easy. Under 30 minutes, in and out, and you know what your health is, you know where your hearing stands, and you move on.
Is it something that you've seen in your many years of being in this profession, a consistency between children that do have a speech impediment or a learning disability? Is there a correlation between that and hearing pretty often?
There can be, and a lot of times, we'll have those children work with their audiologist, their ENT, their speech therapist. Usually there's a team working with that child.
Sure, because a lot of times I think the parents go to their primary physician or pediatrician, and the last thing they're thinking about is a hearing problem. So you're looking at other types of mental illnesses and trying to medicate them for something they may not even need that type of medication for. Maybe a hearing issue.
Yeah, and then when the pediatrician sees that, they will make sure they get that hearing tested.
Good. Okay, so I'm glad that's part of the deal. Now there is some new technology that we want to take a look at that's very unnoticeable.
Yes.
And you brought some to show us today. Tell me about this technology.
So, a lot of patients come in and they say, I want something inconspicuous, very tiny. I don't want people to know I have anything in my ears. So we have a really tiny little piece that will go right into the ear, and it's super inconspicuous.
Now you're going to show us.
And yeah, this is in my ear.
Oh, wow.
So, and
You can't even see it.
Do have a tinier ear canal.
Look
so
at that.
That's tiny. And you can have an app that goes with it too, so that you can control it with an app on your phone and have different programs for different environments. So like for you, listening to music, we have programs just for listening to music or TV, or other programs we put in the instruments for when you're in a background noise situation. Like, for you, you're performing a gig and it's loud and noisy.
Yes.
So that's one option.
Okay. And what is the difference between that one and this one that we're looking at here?
This one actually is Bluetooth. So it is a wireless headset. So you don't need Apple iPods or anything sticking out of your ears anymore. Anything you want to stream, your phone, your TV, music, anything you can connect to, we can now stream it through these guys. And they're also tiny too.
Okay.
So
very
they just go over the ear and a little piece down in the ear canal.
You'd never even notice it.
Yep. And you have an app on your phone for that too.
Impressive.
And your phone calls come right in, so you don't need those Bluetooth pieces sticking out anymore.
The only side effect is that you may look like a crazy person because no one can see that you have headphones in your ears. So you're like, what'd you say, Ma?
That's true. Careful where you talk.
Tuning in from Mars. Yeah. So tell me, why do we need to come in and get that consultation to make sure that we're all good to go, or at least have a baseline?
Just have that baseline for your health to make sure that, when you have that baseline, and if something happens in the future, your physician can actually look at that. We can look at that and say, hey, you might have an issue going on here. You may have had a stroke. Maybe your diabetes isn't being taken care of. Have you been undergoing cancer treatments? And then just watch it, because in life, communication is key.
Absolutely. Definitely. Well, thank you so much, Carla, for joining us. Let's go over the details one more time. You want to call for your appointment or visit hoffmanhearing.com for more information. Call 288-3000 to schedule your appointment and tell them we sent you. They'll give you a lollipop and a sticker at the end if you mention Coastal Living.
And even maybe some homemade cookies.
Ooh, okay. Yeah. I don't know, cookies are part of the deal.
Yeah.
Thank you, Carla, for joining us and educating us. I had no idea about these correlations with hearing, and I'm definitely going to go get checked.
Thank you, my dear. Look forward to seeing you.
Absolutely. All right, guys, we're just getting started on Coastal Living. Don't move a muscle. We'll be right back.